guys for chiming in, and feel free if you have anything going on, go ahead and put the link on the chat, and that's a great way to share, or towards the end, let us know, hey, I put this on the chat. But I'd like to welcome everyone to our April resource meeting. It's not totally live. I miss having the live meetings, and I just got the second COVID shot, and I'm still wearing masks. I'm still sanitizing. I'm still doing everything I'm supposed to be doing. But I feel that the more folks get vaccinated, that herd immunity thing goes, it'll get a lot better. Things will start getting opened up. And then hopefully we'll have a great summer. So welcome everybody to our Latino Providers Network resource meeting. We have some great folks that are going to talk about what they're doing in the community. And I'm just going to just mention them, Monet Horton and Sarah Tukowski from Johns Hopkins Medicine, Allison Glick and Ellen Hobler, the Walters Art Museum, Shannon Jones, Maryland Care Management, and lastly, Andrew Ratner from Maryland Health Benefit Exchange. I'm sure that they have a lot of information for us, and I think there's 4, usually there's 3. So Cindy, you want to say your hellos and set this off?
Absolutely. Hi, everyone. Welcome. So glad to see you all here virtually. Yeah, I've had my 2 shots too. So, but still, my mask is sitting right here next to me. I am ready to begin to venture out of the house and start to see people again and start to go places. I'm very excited about that. So I hope that if you've had your second shot, that you're doing well from it. I know that mine kind of knocked me out for 2 days, but I just kept going. It's worth it. It's worth it. It's worth it. So really happy to gotten to the other side of that, and ready now to get everything started. I still haven't eaten in a restaurant yet. That's my next big thing that I want to do, because I have missed eating in restaurants. Like, I miss it. I miss somebody just waiting on me and like bringing food. Like, that's lovely, and I would like to go back to that. So yeah. So
well, I don't know if Helado Corazon qualifies as a restaurant. However, they've got the best Dorito locals this side of town. I'm telling you,
all the pictures.
It is no joke. It isn't ice cream, not that Dorito loco.
Mm-hmm.
They did some crazy stuff to the Dorito bag and put some great stuff in there, and it's just amazing. And their paletas, as they're called, their icicles, they're wonderful. So just
and that's right by your office, right? So that's
dangerously close to the office.
Oh, and Nick he says the agua fresca is also good.
The what?
The agua fresca is also good there.
See, he went and got
yesterday. Mm-hmm.
Well, I've not had that, so I have to go there and have that.
You're gonna have to go try that out. Try everything on the menu, and then you can give us a review of everything.
I will. The tamarind one is good. The rocket one is good. Good thing they have a fruity bar right next door that does natural juices.
Well, so today and this week it's going to get really hot. So I'm thinking that on Wednesday, I think you're probably going to go over and get an ice of some sort.
I think so. I think so.
All right. Well, David, would you like to introduce our friends from Johns Hopkins Medicine, and they can begin their presentation?
Yes, absolutely. So Miss Monet and Miss Sarah, thank you very much for providing information to us. They always take care of the community with providing information to the youngsters, and it's just wonderful what they do. So I see Sarah. Hi, Sarah. Monet,
hi, good afternoon.
Oh, that's right. Good afternoon.
Yes, it is afternoon.
So there she goes. How you doing, Monet?
Yes, I am great. Good afternoon, everyone. Thank you so much, David, for this platform, and Cindy, and the great work that you do.
So I'm gonna leave you to your thing, and you guys can take it away.
Awesome, awesome. So again, good afternoon to the LPN. Everyone, it's always a great time to connect with you. And my name again is Monet Horton, and I'm here with my colleague, Sarah. We are going to present within our time today. I am a career coach. We're both career coaches at Johns Hopkins within the Department of Human Resources, the Office of Strategic Workforce Development. And so again, today we're going to, because we do so much, we're going to provide you with an overview of our office and the services that we provide. So hopefully you can see our screen and information, and we're going to get through this information today. And so we want to start out just with a quick overview of our office and the services that we provide. And my colleague, Sarah, she'll jump in and provide some specifics as well. And so in being career coaches and through the Office of Strategic Workforce Development, already, and of course, we do support our incumbent employees of Johns Hopkins in their career development. And here you'll see the 4 key services that we provide. The first is what we call workforce forecasting. And that is when we work with our internal partners, our departments, and also our recruitment talent acquisition team to identify what are those positions that will become available, currently available, or 3 to 5 years out, so that we can begin to not only work internally with our departments and employees, but also to reach out in the community to work with our partners to identify other individuals external to fulfill or fill these vacancies that we have within our institution. And so again, that's our workforce forecasting. Also, we have our Project REACH program internally, which is REACH stands for Resources and Education for the Advancement of Careers in Hopkins. And this is really where we concentrate our career coaching services. This is definitely available, and we want to share this with our community, because anyone that you're working with that becomes employed by Johns Hopkins, there's always an opportunity to work. I say that we are an institution where you can live, work, and grow. And so we always support in that regard. One of the great services through our Project REACH program is what we call salary release time. And this is available for any employee who's been with us for at least a year in good standing in their department. And they are seeking, and they're also full-time, and they're seeking out a degree in an area that's a critical shortage area in healthcare. So it could be surgical tech, it could be nursing. We are always looking for nurses. It could be respiratory therapy, physical therapy, but any area that's a critical and chronic shortage within healthcare, it provides the employee an opportunity to get released 16 hours from their regular work schedule, full-time work schedule, to delegate to school, only work 24 hours in their department, but in the end, still get their full pay. So our office will, in essence, pay those 16 hours of release time. This is a great opportunity for individuals to balance their work and their school schedule, because we know that that's usually a challenge. And so again, this is something that anyone can look forward to if they fall within that eligibility requirements. And then we have our community adult programs and partnerships, where we consistently provide support for or connect with our community-based organizations and partners to help individuals in the community to align to our vacancies, openings within Johns Hopkins institution. And then we'll also talk a lot a little bit more about our student programs and partnerships, which is our long-term strategy within Johns Hopkins to expose youth and young adults to careers within healthcare. And our community partnerships, we're going to talk about our Hopkins Local Initiative, our on-the-job training program, as well as our direct hire support, re-entry, and our college partnership program. And so, of course, with our slides, we won't go over everything in detail because it's too much information, but just a couple of highlights. And so quickly, our Hopkins Local Initiative has been around for about 4 years now. And this is really, not sure if you all have heard of the Hopkins Local Initiative, but this is Johns Hopkins' commitment to work with our community partners and our community to hire Baltimore City residents from targeted zip codes. And this is our higher portion of the Hopkins Local. And when it comes to our build portion of Hopkins Local, is Johns Hopkins' commitment to leverage its economic power in terms of any building contractual projects throughout our campuses. If you're ever on our campus, you'll see a building going up, moving to the side, some kind of construction is going on. So it's really our commitment to work with minority-based construction companies in that regard. And then the buy portion of Hopkins Local is our commitment to work with minority-based companies in purchasing any products, any supplies across our campuses. I'll also quickly go over other services, as I mentioned, through our community adult programs. The first is our Transitional Employment Partnership Program. When it comes to our Transitional Employment Partnership Program, this is also where our on-the-job training comes under this. And this is our efforts to really connect community adults in the community who may be unemployed or underemployed with a internship to literally work in a position that they could be hired into after 89 days of being in the internship. There is no guarantee of employment for this particular internship. However, the goal is for individuals who may have gaps in their work experience, may have had some challenges in their maybe a criminal background, perhaps they may have a disability, maybe on the spectrum, may have a disability, and they're really trying to really disconnect to employment. This program is a great opportunity for individuals referred by our community-based organizations and partners to get their foot in the door. And so if you have any questions about that program or have residents that you're connected with, they've gone through job readiness programs or job readiness, and they are ready to connect through the on-the-job training, this is a great opportunity as well. We're also working with ESL programs and other Latino focused groups to increase the Latino residents' exposure within our institution. Also, another service that we provide for individuals that are working with our community partners, and they are definitely ready to connect with direct hire support and employment. We have our direct hire information and application help sessions that we host on a bi-weekly basis. I've come on a couple of times and shared that information, but this opportunity is definitely designed for individuals who are job ready. Perhaps they may have had some challenges in navigating the Johns Hopkins regular hire process. And this is an opportunity for our office to support any external candidates in navigating that process, getting feedback from our talent acquisition office on those openings that we have for regular hire. And then we have re-entry support. This support is designed for candidates who, again, may have a positive background. First and foremost, we want to make sure everyone knows that Johns Hopkins, we welcome everyone to apply to our either on-the-job training process or direct hire. But this is really designed for us to provide an additional layer of support for anyone who is returning or re-entering the workforce. And then Sarah will definitely give more information on our college partnership program. Some other features of our community adult programs are the information and application help sessions I mentioned. We also, again, host them on a regular basis, bi-weekly. We do have assessments that we host that we administer on a case-by-case basis. They may be fall in within any of these categories: career, interest, aptitude, work styles, educational. Anyone in our community adult programs also receives career coaching. We also want to just cover eligibility requirements across all of our services. Any external candidates coming through, they definitely have to complete the background check screening as well as occupational health. And we want to make sure included in that is making sure, depending on the position that they are applying to, that we have the educational verification, and then of course the I-9 process. When it comes to background screening, we just want to make sure, again, that everyone is welcome to apply, but on a case-by-case basis, we work with our background staff to determine what are the positions that are best fit for the candidates that are applying. Some things that the background personnel look at is what the infraction was, how long ago the infraction, or I should say how old the candidate may have been at the time of the infraction, what have they been doing ever since. And again, we really look at it case by case. When it comes to occupational health, we just really want to make sure that the candidates are physically fit for to complete and carry out the functions of the job they are applying to. An I-9 process we see here determining eligibility to work in the United States. This here is just an overview of the direct hire process, but I will actually allow my colleague Sarah to jump in here.
Thanks so much, Monet, and good afternoon again, everyone. My name is Sarah. And so just as Monet was describing some of those community adult programs, I want to just take a few minutes to describe two additional community adult programs, the first being our ESL provider partnerships. And so back in fall of 2020, we held an initial convening of ESL providers in and outside of Baltimore City to really propose this idea of creating a pipeline to opportunities at Johns Hopkins for their highest level ESL students. So just as you heard Monet say, those application and information sessions, this is what we are hosting and holding for these ESL programs, but really making sure that each program, that it's a unique pipeline that works for their students. And so being able to guide their students who identify positions of interest and that they have the skills and experience for these positions, guiding them through as they work to submit an application and go through the hiring process. So in addition, we also have our college partnership program. And so this is a recently formed program here. It is a partnership between the Office of Strategic Workforce Development as well as the Johns Hopkins Health System departments that choose to participate. So it's really an opportunity for our upper level undergraduate students, so juniors or seniors, as well as graduate students who have this background in STEM, data management, analytics, or another critical shortage occupation area identified at Johns Hopkins Health System. So we are providing internship opportunities, paid or college credit within some of our departments. So this really allows for students to gain exposure to careers that they're interested in in careers in healthcare as well. And the goal of targeting those upper level undergraduate students and graduate students is that they are going to be ready to graduate and seek full-time employment. And so we want to help them find those positions at Johns Hopkins. And so on the next slide, I'll kind of overview quickly what are the eligibility requirements to participate. And so in order for students to be eligible, they must be currently enrolled at a college or university. Again, upper level undergraduate students as well as graduate students. They have to be referred by a college, as well as complete a community adult intake form for our office, and then go through the normal application, interviewing, and onboarding process for all Johns Hopkins positions and employees. So if you are a college or a university on here today, or you know of a college or university who might want to create a pipeline for students, you can feel free to reach out to us. We'll share information at the end. And just so you all know what this looks like and how we match is our internal departments request an intern. They give us kind of a job description and let us know so that we can match student skills and really meet the needs of that department. And so in addition, really quickly, I want to highlight some student programs. And so these are really just to provide exposure to careers in healthcare. The first being our Hopkins Familia Speaker Series for Latinx students. So this is a partnership between our office, the Office of Strategic Workforce Development, and Hopkins Familia, our employee resource group. It's a monthly speaker series allowing for students to gain exposure to careers in healthcare from individuals in non-clinical and clinical roles across Johns Hopkins entities. It allows for students to ask questions and get some answers to guide them on further career exploration. And it also provides space for students to engage in small group discussions on a variety of cultural topics. Our next program is our Johns Hopkins Summer Jobs Program, which is oftentimes what many people first think of when you hear student programs in our office. I want to preface by saying this program is well underway. So we are already at the point of matching students with departments and mentors. However, just to provide this information for you all, in case you have students or you want to know about the process and prepare for next year. And so it is a program sponsored by Johns Hopkins Health System, as well as the university in partnership with YouthWorks. And so just a general timeline, you can expect the YouthWorks and Hopkins applications to go live in January of next year. Then students will go through a verification process through YouthWorks. Then it moves into interviews, matching, orientation, and then the start of the program with us. So that all happens as we get into March, April, and May. But just want to point out the most important point there, that applications open at the end of January. Students have to be Baltimore City residents and Baltimore City school students. They have to be at least 15 years old by the start of the program. So this year, that date is June 28th. That date will change next year. They have to have a passing GPA and good attendance, complete all the steps necessary through YouthWorks as well as us. And so we can go ahead to the next slide. And just in light of COVID-19, everything will be virtual. So our last program here for students is our School of Medicine Student Pipeline Program. So this is really an opportunity for students who are high school students, undergraduate students, or post-baccalaureate students from communities underrepresented in medicine to gain exposure to careers in medicine or biomedical science. And it really allows for them to develop some skills, also provides academic, social, and emotional support, some mentorship components, and really encouraging them to enhance their success moving forward. Again, this will also be virtual just in light of COVID-19 restrictions. So,
All right. And so with that, we are, I believe, if there's any questions, Cindy, you can let us know if we're still within our time. I'm so sorry.
No, you're
But
fine.
definitely a lot of information. I will put up our contact information. If anyone has any questions, we can also drop this in the chat feature and also send an email. We know that was a lot of information, but most of all, we're looking to partner with our community-based organizations. If you have anyone who's interested in the youth programs or have anyone who's interested in our adult programs, the service through our community, either on-the-job training or direct hire support, please contact our office.
There is one question. Is the program for high schoolers only for Baltimore City residents?
Great question. Yes.
So I have a question. So when you were talking about like the youth workshops are going to be virtual this year, what kind of things are the students going to be doing as virtual work? I'm just
Right.
curious what they might be doing.
Yeah, that's a great question. So we actually have 2 tracks for this program this year, in light of just COVID-19 restrictions and to really allow for students to gain exposure to careers in healthcare, regardless of if they're on site or not. So our first track is students are matched for virtual work with departments. And so a department would give them assignments to complete virtually. They'll have a mentor or supervisor in that department. So tasks can really range. We leave that up to the department to decide what sounds like a good project for the students, keeping in mind they're there 6 weeks, but they're only there 4 hours a day. And so what can they realistically do in that time frame? The other track is our online career engagement platform. So that one is housed within our office. We have mentors from across the health system who will participate and really host mentor group discussions with students. But on that platform specifically, we're relying on our employees across the health system to talk about their careers. So really allowing for students to just gain exposure to careers in healthcare from individuals in those jobs. So we're really excited. We think it'll be great for them to just have those people sitting in front of them, ask questions so that they can continue their own career exploration if they hear something of interest to them outside of the program. So that's just a very brief overview of how we're adapting to virtual work.
That's amazing. I was just like, what are they gonna do?
Right, we'll keep them busy.
Absolutely. And then the other question I have is, so your internships that you're doing, so they don't have to be Johns Hopkins University students. They can be going to a different college, right? And
That's
still qualify for an internship with you guys?
You're exactly right. So that is extended outside of just Johns Hopkins University students. So really looking to build partnerships with surrounding colleges and universities who are interested in creating those pipelines to internship opportunities for students. Again, those can be for college credit. So we might work with an advisor and a student has to complete an internship for college credit. However, they can also be paid as well. So just kind of up to what the student and the college or university is most interested in.
That's amazing. So what I've learned from this, Monet and Sarah, is that there are so many opportunities at Johns Hopkins for employment, but also for students to sort of get their foot in and learn about healthcare. And the fact that they can get paid or get college credit is amazing. I know I would have really appreciated that when I was a college student. So that's amazing. I don't see any other questions. Does anybody else out there in our audience have questions for them? Give you a second to type them in. But what I do know, and I bet you're going to say yes to this, Monet and Sarah, is that if there's anybody who's having like a community group meeting and they would like to spread the word about these opportunities at Johns Hopkins for internships or employment, that you would probably be happy to attend their meeting and share this information with the community.
Most definitely.
You got it.
So, so Marlon our friend Marlon from the Alzheimer's Association asked if you guys have already reached out to different community colleges and universities to sort of start making those partnerships for the internship programs.
Great question. We have preliminaries, program coordination going on and partnerships that are up and running. However, we're really looking to expand that. And so if you have an idea of a college or university or know of one, please feel free to have them reach out to us. We'll make sure that our contact information is available.
Awesome.
And I just want to add that, I've been part of some of the getting together with the youngsters that do apply and that are part of this program. And I got to tell you, I've met some great kids in this program, and you guys are awesome. Just guiding them and showing them what it's like in that medical field, just to get them going, just to get them started. So I appreciate what you do, Monet and Sarah. It's wonderful for the youngsters. And now that I see the adult programs, I have some folks in mind that can use this program, so I'm going to certainly connect them with that email. So, I mean, with that link.
Absolutely. Thank you so much,
Thank you.
David. You've been amazing when you've come and talked to all of the students, 200 plus students.
Yes.
And so you've been amazing. So again, thank you both for this opportunity. We just dropped our information in the chat. And if you are Sarah, you said around this, but if you are interested in connecting and want to be a part of our listserv for our community partners, send us an email to the community education and we'll connect with you. Thank you.
Awesome. Thank you,
Thank
ladies,
you.
so much. That
Thank
was
you, ladies.
wonderful. Appreciate it. All right, David, what
That's
do you
some
think
good.
about that? Isn't that amazing how what the number of opportunities that students and adults
Yes.
have with Hopkins? Like, I
Yes.
didn't realize they did all those programs. That's really amazing.
And you know, I have a clip of the program and you know, just talking to these youngsters, and then afterwards they all came to me, and then we had a little round table of what they should be looking at when they go to college. So I'm gonna create a little video. It's like a 3-4 minute video and just post it with the I don't know if I'm able to, so I'm gonna reach out to Monet and see if I can just post something in our website regarding this program. I think it was done before COVID, so you know, no one's wearing a mask and no one's. It was just amazing to see these kids ask questions and kind of see what they were thinking. And that being said,
so I just want to answer. So Barry put a question in the Q&A. Barry, have this person that you're referring to in your question reach out to Monet and Sarah. The email and their phone number is in the chat. So have that person reach out to them directly with to figure out where they can get started. All right, David. Our next presentation is from our friends at the Walters Art Museum.
yes, Miss Allison.
Ellen.
She is no stranger. No stranger to the Latino Providers Network, you know, no stranger to the community. So I would like to introduce, I believe, is Miss Ellen and Allison, chat about the Walters Art Museum, what's going on, how we can get involved, how we can go there and interact with you folks. You guys always put on a good show, even though it's virtual. Although, got to tell you, every time I think of the Walters Art Museum in October or towards the end of the year, I think about
hot chocolate
with the spice. I cannot duplicate it. I think it's just something about being at the art museum, looking at the folks and drinking some hot chocolate. It can't be duplicated. I can't duplicate that feeling at home. So, but with that, ladies, take it away. Give us the information. Make us aware of what's going on.
Thanks. Hi, everyone. I'm Allison, and I'm the Community Engagement Coordinator at the Walters.
Hi, and I'm Ellen, and I'm the Curator for Art of the Americas at the Walters.
So we have a very quick presentation that we'll share that just sort of talks about all the different opportunities you have to engage with the museum. So we're located at 600 North Charles Street, and we are open now to the public. So we are at limited capacity, but if you are interested in doing something outside of your house, this is an option for you. So if we're right in the Mount Vernon neighborhood, so if you know where the Washington Monument is, we're right there. We're open Wednesday. Oh, so here's a map from Sacred Heart where we normally meet when we get to meet in person to the museum. So you can see it's a pretty quick 15 or 20 minute drive, depending on what route you take.
Also, I just wanted to point out that not only are we open, but I know some other museums, you have to make a reservation to come in. There's no reservation needed. You can just come on in. We are at 25% capacity. We will ask you to wear a mask and to social distance while you're in the museum, but you can just come in anytime you want to. If you happen to be in the neighborhood and you have an extra 15 minutes, that's a great time to come in.
Yeah, definitely. And the museum is free, so you never have to worry about any kind of admissions fee. So, you know, bring your whole family if you want. There's no limitations there. And we have some different bus lines, light rail stops, the Charm City Circulator, and the Hopkins shuttle all provide pretty quick access to the museum. And we're open Wednesday through Sunday from 10 a.m. till 5 p.m.
And we'll come back to summer camps, but right now we do have on view a new exhibition that opened up in March when we reopened. That is called Translations and Transitions, or Traducciones y Transiciones, and it is kind of commemorating, it's a celebration of Mexican and Central American independence, 1821 to 2021. So obviously 1821, I know you people who are from Peru or who trace their ancestry to Peru, that also had its independence. We do in an adjacent gallery have a painting that kind of has relations to the independence from Spain of Peru as well. But for this exhibition, we're really just tracing different indigenous cultures of Mexico and Central America, and kind of how some of their forms of knowledge were foundational to this area. So it's a small exhibition, just 6 cases plus an extra painting. Maybe we can go to the next slide and just take a look at it. But it's very manageable. Again, if you have half an hour, if you have an hour and you wanted to come in and see it, that would be great. And so, yeah, it's sort of indigenous forms of knowledge and how they were translated, how they were adapted, how they were prohibited, but still continued to be practiced in the colonial period and afterwards. So it gets at themes like indigenous languages, and actually it gets, David, at chocolate, sort of the gift of the Americas and particularly Central America for the world. It gets at animal knowledge and mapping and deities and astronomy. So it's a really fun exhibition, and we're doing a whole slate of programming around that will be available. Maybe we can go to the next slide. And then we have, so one part of this is a beautiful painting by local Baltimore-based artist Renee Trevino, which he calls Reclaiming the Constellations. And this is sort of about thinking about decolonization in the intervening 2 centuries since independence from Spain, and thinking about reclaiming different aspects of indigenous culture, etc. What is really nice about the exhibition is that all of the labels are available in Spanish, either via QR code or by picking up a set of labels at the visitor services desk. So we haven't gotten fully onto parity in the sense of we don't have the labels right there on the label rail. I am just too darn long-winded as I write, but we do have all the labels available in Spanish, and they will be available as well on the website if you want to, pretty soon, if you wanted to get a sense of what's in this exhibition. So I really cordially invite everybody, please come. We would love to see you, and we hope this will be of interest and something that people will really enjoy, to be thinking about independence and commemorating important anniversaries of Latin America.
Another thing that we do at the museum, in addition to exhibitions, like Ellen was just talking about, is we have 4 major community celebrations that we celebrate every year. So MLK Day, Lunar New Year, Dia de los Muertos, and monument lighting. Many of you have probably been to our Dia de los Muertos celebration. I know that LPN and a couple of different organizations have come and tabled on site and shared information with audiences that way. I think what we have today is actually a survey for you about Dia de los Muertos and your interest in participating and guiding and shaping the future of what that celebration could look like. Let me see. We also have digital resources, which are really exciting for families, so and adults and kids of all ages. So if you have a desire to make some art making, please don't let the fact that these are geared towards kids and families stop you from engaging with them. So you can visit our website, thewalters.org, our art website, which has almost all of our collection digitally available. So if you want to go and like do a deep dive into the pieces that are you see in Ellen show, you could go to our art website and dig down a little deeper and learn more about those. We also have a YouTube channel. So if you want to see a more in-depth discussion between Ellen and the local contemporary artist, Renee Trevino, that she was just talking about, we had a program last week where he really talked through his practice and that piece that's in the show. So if you're interested in that, that's something you can find on our YouTube or our Facebook. We also have an Instagram. And I have a survey that I'm going to share in the chat. But we also just wanted to share our contact information. So these are the emails directly to Ellen and I if you have questions or want to get involved with the museum in some way.
Yeah, I'm looking at the comments. Yes, it's been a crazy time and nobody has been able to celebrate this really exciting bicentennial of independence as they would have liked to. And in fact, even museums haven't been able to celebrate it. As far as we can tell, we may be the only American art museum to have gone ahead and managed to do an exhibition to commemorate this. There were other museums that were planning it before COVID, but then I don't know, it kind of fell off the docket. And so it is small but mighty, but we're really pleased to have this, and we're really excited to have programming about this and to this being sort of the beginning of better outreach, I would say, towards the Latinx community here in Baltimore.
Right, and I just posted the survey in the chat, and it's really about whether or not you visited the museum before and whether or not you have any interest in, contributing to shaping what the festival could look like in the coming year. So we're probably going to do something this year that's a little bit of hybrid. So we'll have probably a couple of things available on site, but also a majority of things probably still online just for safety concerns. But, we really look to the community and your feedback for shaping what it is that we present at the museum. So if you have an idea for something that you want to see at our celebration specifically, or if you have an idea for an exhibition or program, please feel free to put that in the survey.
Yeah, and I think it also says there, if you want a tour of this exhibition or of any other part of the museum in English or in Spanish, it may be from me in Spanish, so it will be, it will not be as elegant as when we had our fabulous docent Alejandro from Venezuela, but happy to give a tour, have done some tours. Oh, okay, maybe some issues with permissions, but we are happy to give tours of any part of the museum for groups if people are interested, or even like a virtual tour of this exhibition. I had given a talk about this that's sort of like a virtual tour, but we're happy to walk through it for anybody.
So are you folks allowing people to come in groups of
Up to 10.
X?
Up to 10. No more than 10.
Okay. I think what I like to see, and I'm sorry, Cindy, I cut you off twice.
You're the president, you can do it, it's fine.
I think what I was thinking of, during this exhibition is LPN and Walter's art night. I have a
lot.
I just purchased a small bus, and it houses about 15 people. So I think we can get 10 people in there and just have a nice little get together. What do you think, Cindy?
I'm in. I would like to go. I would like to go on the little bus. I'm excited.
Yes, we are. I was researching the bus, and in Central America they have a lot of chicken buses. It's what they call them, but they're very, they're very.
Are they buses just for chickens?
You know what? No,
Oh,
I think
okay.
it's because they pack them in so much, and anyway, the way they do their artwork on the bus was very interesting, and I want to try to do that, and I want to try to replicate that, and I want So you'll see the bus in the near future with that type of artwork on it. And hopefully my son will help out.
Very nice. Very nice.
But yes, I'm going to talk about getting some folks together to come up to the museum.
We
I
would
think
love
that would
that.
be fabulous.
For right now, we're only open till 5 from Wednesday to Sunday, but I know there's been talk about potentially in the fall staying open on Thursday nights like we used to be, but it's not all firmed up yet. But if you let us know a day, I'm sure we can work with you and we can try and work with you and be flexible, or else have you come in at 4 and then we'll have a drink outside it could be chocolate. Any kind of drink outside in the park afterwards.
Well, I know what David will put in the survey. He will put in the survey that he wants that hot chocolate. That's what I know that he will put that in the survey.
I downloaded the survey. I haven't got into it, but I am definitely going to mention chocolate with that spice whenever I can.
So there was one question that I saw in the chat that asked about summer camps. Are you guys doing summer camps this year?
As far as I know, we are not doing summer camps this year. I know that we do have a partnership with the Pratt Library where we're doing art making kits. So you can order an art making kit through Sidewalk Service. And there are directions in English and Spanish for all of the activities that are available through those. But as of right now, I don't believe we're going to be doing summer camp. Sorry.
I can tell you that the art kits that you gave to the Baltimore County Public Library went like fire out the door. People were so excited to get those kits. Families we ran out of them so fast. So families were very excited about it. So thank you for that partnership that has nothing to do with LPN, but just for the families out in the county, really appreciated that. So thank you.
Great.
I know that thanks to one of our sponsors, we just gave out another 1,000 art kits to the Patterson Park Alliance, and some of those were given out recently at the Dia del Niño and the Go Fly a Kite initiative. So there may be extra ones there. I'm not totally sure about that.
Yeah, and we're going to have more programs coming up.
Thanks to PNC Bank for that. We should just,
Yes,
sorry, but we should be all corporate and say thank you,
Yeah.
PNC Bank, for those art kits.
We do have we will also have some additional digital programs coming up soon for Ellen's exhibition, and we'll make sure to send a reminder about those to Cindy to share with everybody, or we'll share at the next announcements. So, but please feel free to let us know if you have any other questions, or if your organization is looking for a way to potentially partner with the museum. We would be so excited and happy to talk about that.
Awesome.
Well, thank you so much. Appreciate it.
Thank you very much.
Appreciate the art, the Walters Art Museum. It is always a wonderful place to visit, and now you can visit in small groups. Thank you, guys.
Thank you very much. Wow, awesome.
So such good stuff. Such good stuff. And now we have even more good stuff with one of our newest members of the LPN. Welcome,
Yes.
Shannon.
Thank you.
Welcome.
Thank you. Thank you for inviting me. I'm excited to be a part of the network. I'm very excited to start collaborating with some of the organizations, or many or all of the organizations that wish to collaborate with us. So I really appreciate the invite. So I'm here today to talk about the free healthcare insurance that Maryland Physicians Care offer. And
Awesome.
I'll go ahead and share my screen. I'm sorry.
No, you're good. Awesome.
Let's see. Okay, so here we are.
Awesome.
All right, so I'm the manager for the Community Engagement Department with Maryland Physicians Care. I've been with the company with Maryland Physicians Care for a little over 20 years. So I know a lot about the company and the benefits that we offer, and I'm excited to, like I said, be here to present them to you. The Community Engagement team is a rather unique team. We're out in the field. We're called kind of the boots on the ground to be out promoting and represent MPC, but also we educate organizations on how to educate the community about free healthcare insurance. So I have about 9 reps. We have a rep that represents all the way from Garrett County, all the way down to the Eastern Shore. And the 3 reps, lovely reps that you see on the screen today, these are all 3 bilingual reps, Zuma, William, and Stephanie. They are actually working in the areas that we have our largest Hispanic population. But they're always available for some of the other areas as well, or for all of the other areas if we need help with translation or with providing services to our Hispanic Latino community. But I am also proud to say that MPC, this year we're celebrating 25 years of providing healthcare services in the state of Maryland. So we're excited that we've been around that long and we're able to make sure that our community gets quality healthcare insurance. So just a little bit about MPC. We're a managed care organization. We administer healthcare services to Maryland Health Choice enrollees. We are open year-round for new enrollees statewide. So you can go through the Maryland Health Exchange, Maryland Health Connections to see if you qualify, or they can, members can see if they qualify for the healthcare insurance, and certainly choose Maryland Physicians Care as their managed care organization. We're definitely committed to ensuring that we have access to quality care, affordable health care for Maryland Hispanics and Latino communities, as well as other communities. MPC engages with Hispanic communities across the state of Maryland. We partner with lots of different providers, from primary care to specialty services, who speak Spanish language. We also make certain that there are no barriers to accessing care due to language. So we'll provide assistance with interpretation and translation services as well. We conduct bilingual outreach to community members and organizations. So we have bilingual reps in mostly all of our departments. So if someone calls into our member services department and they need a bilingual rep or someone who speaks Spanish, that's available as well. And we also attend lots of events out in the community. Due to COVID right now, we're doing a lot of virtual events, but we are starting to see that organizations are starting to get back to normal, and they're starting to send in-person events. So we're doing those at a social distancing, in a social distancing way, but we are out there in the communities. You'll see us out there with our blue shirts on, our MPC signs, and we're giving away lots of great giveaways. And at the same time, we're letting folks know that help is here. We're here to make sure that those who qualify for the free healthcare insurance, that they know how to get it, they know where to get it, and they have the opportunity to apply for that coverage. I mean, right now with the pandemic, healthcare is definitely needed. There are folks who have, had private insurances all of their lives. They never really had to apply for free healthcare coverage. So we want to make sure that everyone knows that there's help here, and there's a way that you can apply for the free healthcare coverage to see if you qualify and to obtain that service, so you don't go without. And we want to make sure our communities are healthy. So here's some of the benefits that MPC provides, Maryland Physicians Care provides at no cost. So we have COVID testing and vaccinations that's covered for our members, primary and specialty services, prescription drug benefits. There are no copays for over-the-counter prescriptions. There's a list on our website of over-the-counter medications that we cover. We offer an enhanced dental care benefit. We went from covering, I believe, like $250 worth of dental coverage to covering $750 worth of dental coverage. And not every MCO offers dental coverage. And we know a lot of times, a lot of things that are happening with folks' healthcare starts with their dental, and it prevents them from getting additional healthcare services. So we did enhance our dental services as well. Vision care for children and adults, immunizations. I want to talk about our My Virtual MPC program. We have like a virtual doctor's app where you don't have to spend any time going to the emergency room or to urgent care centers to receive non-urgent services. So they can use this app on their phones as long as they're a member of MPC. call in and speak with an emergency room doctor that we have on call, and they can receive prescriptions called in. You can do a video chat. If, your child has a rash or a laceration, you can turn that video on and show it to the doctor so he can tell you what the next steps are. But we're, just trying to fit in and be convenient for our members at this time in the crisis. Being at home and receiving those services, if it's non-urgent, is most definitely important. And then we also have another app that we offer to our pregnant moms, during pregnancy and after pregnancy, up until the child turns about 4 or 5 years old. It's called the Pacify app. This app allows moms to have access to lactation specialists 24/7. So instead of relying on, the WIC office, who are often so busy, and not everyone can be serviced by their lactation specialist, and they're not open on the weekends, our members receive 24/7 virtual lactation consultations through this app. And they also get to speak with the case manager, nurse case manager as well, if they need additional assistance regarding their health care. We provide urgent care services, medical care coordination. We have case management for folks who may have multiple comorbidities such as diabetes, asthmas. We have different programs that members can join to help them control those type of conditions. And lab testing and screening x-rays are also covered. MPC Source allows members to conduct the following services. So there's an app available that you can go on and request a change of your primary care doctor, request a new ID card. You can view benefits and claims and eligibility history. I mean, there are all types of things you can do just at the palm of your hands instead of waiting on hold to speak to one of our member services reps. We try to make it easier and convenient for our members to receive the things that they need right then and there. So this also just briefly talks about the My Virtual MPC app. If you feel sick, but it's not an emergency, we encourage our members to use the app right in the comfort of their home or wherever they are. They can, pull the app up on their phone, like I said, and speak to an emergency room doctor if they need a refill, just not feeling good, not sure, what's going on. And if it, makes them feel better, to speak to a healthcare provider. And, at this time, no one really wants to go to the emergency room or urgent care. We all want to stay safe. So this is an app that we provide, and we have been providing before COVID, and we've been advertising before COVID. And it just, it's really handy now to stay safe when you have non-urgent issues. So to learn more about MPC and to tell us what we can do for you, here's some contact information for our website. We're also on Facebook, we're on Instagram. We're out in the community, serving our communities, making sure that we are educating organizations, excuse me, we're educating organizations about the services that Maryland Physicians Care provides. Our community, I just want to briefly speak about our community engagement team. Like I said, we have a rep that covers from Western Maryland all the way down to the Eastern Shore. So right now we're speaking with organizations on the phone, just trying to build a relationship and collaborate with organizations so we can better teach them how to advocate for free healthcare insurance for the communities, for folks who need that. A lot of folks and organizations are unaware that free healthcare insurance exists. So what we want to do is partner with these organizations so we can teach them to advocate the free healthcare insurance. So if you're an organization and you're having an event and you feel like it's helpful for an MCO to get out there and spread the word about free healthcare insurance, please, you can go on our website. There's a link on there that you can submit your event to, and it'll come directly to me. I'll be in touch with you. We'll talk about the setup. We'll have giveaways. We're going to have a couple vans that can come out, and we do exciting things for our communities to make sure that everyone's aware free healthcare is here and it's available.
But will you have hot chocolate?
Hot chocolate, I probably can bring you a pack from my kitchen if one of my kids haven't drank it all. I have a 15 and 16-year-old and they drink hot chocolate.
You don't have hot chocolate at
But
home.
I don't have any on site.
Yeah, I bet you she has fun giveaways.
I do.
Yes,
We
I
have,
bet
we
you
have
she
some
does.
exciting giveaways. We try to promote healthy eating and exercising while we're out there, but we also provide literature on different healthcare disparities like COPD, asthma, HIV. And we also always have a clinician that we can speak to and that's on hand. If we have any clinical issues that come up, we can call in and get that person connected if they're an MPC member. So our goal is to make certain that the community knows and is aware of free healthcare.
And when you are invited to the events and you need a Spanish rep, you'll engage one of your Spanish reps to come out?
Absolutely.
Okay.
Absolutely. They'll come out and they'll assist with the event. We'll have a couple, if needed, to come out and assist with the events as well.
Awesome.
Yeah.
Awesome.
Do we have any other questions in the chat?
Well, there is one question in here that says, if we know of a Spanish-speaking parent interested in enrolling their family for medical assistance, is there a number they can call for help? Like, who can they call? What's the number for them to reach out to you guys?
Okay. So they can call our 800 number, 1-800-953-8854, or they can go on our website, MarylandPhysiciansCare.com. And as soon as you go on the website, there's a link that says for you to apply, and it'll take you to the Maryland Health Connections website. So Maryland Health Connections is the starting point. That's where our low-income families have to go to apply for free health insurance. And if they qualify, they'll become, straight medical assistants, and then they get the opportunity, I believe, within 30 days to choose an MCO, such as Maryland Physicians Care.
Oh.
All right, so they need to start with the Maryland Health Connection.
Yes.
Okay. Well, we'll ask our next presenter about that because he
Yes, we
runs the
will.
Maryland Health Connection. So
Awesome.
we'll talk to him about that. I don't
Yes.
have any other questions for you, Shannon. I think that you did a great job.
Thank you.
I know
Yes,
she
thank you,
said she was
Shannon.
a little nervous. I couldn't tell at all. You did a fantastic
You were a
job.
little nervous.
I was, absolutely. I mean, I'm with a new group, but I'm always excited to hear new things. And I'm gonna tell you, the presenters that presented before me had me in here taking notes, trying to figure out, okay, what am I gonna say next? I have to be in line with them. I hope I was able to do that.
You did a fantastic job.
You sounded like a pro.
Do me a favor,
Thank you.
Shannon. Drop the phone number, your 800 number,
Absolutely.
and your email address in the chat. So in case there's anyone who wants to reach out to you, it looks like our friend Marlon from the Alzheimer's Association is going to want to be reaching out to you. So definitely share that information so that anyone can get in touch with you if they have questions. And
Absolutely.
thank you so much.
Thank you. I look forward to attending many more. Have a good one.
Thank you, Shannon.
Thanks,
Thanks.
Shannon. So speaking of Maryland Health Connection,
I know.
Andrew, I said Maryland Health Connection, and Andrew just appeared on camera. It's like magic, like you knew.
He was on point. He was listening. He was ready with his button.
He was ready.
He's like,
He
as soon
was
as they
ready to
mention
go.
me, I'm on.
Exactly. All right. So everyone, this is Andrew Ratner, and he is with Maryland Health Connection. So Andrew, you heard Shannon's presentation. So
They like us.
you take it away now.
Thank you very much, Cindy, and thank you to the Latino Providers Network. So happy to have this opportunity to speak. I can't get my mind past spiced chocolate. And health insurance is not quite spiced chocolate. So I'm going to present. I'm going to present my screen and explain about Maryland Health Connection. Again, thank you very much, David, and the network for having us to talk about what Maryland Health Connection is, and a great lead in from Shannon, who did a great job. So Maryland Health Connection is the official health insurance marketplace for the state. It was created by Maryland about 10 years ago to help bring the Affordable Care Act to Marylanders. And we've come a long way during that time. You can access Maryland Health Connection on the computer, through your desktop, through smartphone, through tablet, marylandhealthconnection.gov and marylandhealthconnection.gov/yes. we have perhaps one of the few mobile apps in the country that allows you to apply directly end to end on the mobile app. Admittedly, it's largely young adults who are very adept with mobile apps and such doing that, but there are plenty of ways to apply, and I'm going to talk about that in a couple of minutes. It is the only place to get financial help when applying for health coverage for yourself and your families. In fact, 9 out of 10 people who enroll through Maryland Health Connection get financial help to drive down their costs, their monthly costs of health insurance. It is often free or low cost. People who qualify for Medicaid or the Maryland, or whose children qualify the Maryland Children's Health Program, that coverage is free. The threshold for that in most cases, when it's income based, it would be a family of 4 making less than $36,581 a year would qualify for free health coverage currently. And for an individual, it'd be making less than $17,785 a year. But you could make 2.5 times that much money and still qualify for federal tax credits to lower the cost of your health coverage. There are cost sharing reductions to lower the amount of out-of-pocket costs like deductibles when you apply for a silver level plan, and I'll explain a little bit more about that. And also, again, the advanced premium tax credits that can lower the cost of and are paid in advance up front. So to you to, again, lower the cost of your monthly health coverage. There are plenty of people that we've talked to over the years who said, my God, this was such a godsend for me. Before the Affordable Care Act, I couldn't afford coverage. And now I'm paying a fraction of what I would have been paying before if I could have afforded it. And since April, since the American Rescue Plan was passed, I think there are plenty of people that in recent years who we talked to who said, you know, I still can't afford it, should definitely be looking at it now. The amount of financial help available is substantial. Again, that the American Rescue Plan, if you are uninsured in 2021, even for a couple of weeks, the amount of financial help to get coverage for the coming year is immense. And we know just since we launched it on April 1st, over almost 2,000 people who are already covered with us have improved their plans and driven down their deductibles. That's the amount you pay, say, before some of the coverages start kicking in. And maybe someone before might have had a deductible that was several $1,000s a year, sort of expensive. They were able to drive that way down and pay no more per month because of some of the changes brought in by the American Rescue Plan. If you didn't qualify for savings before or someone you know, they should definitely take another look at it because at least for the next 2 years, it's a great bargain. And I know that there are moves in Washington to try to make it extend longer than that. A 27-year-old Marylander making about $25,000 per year can now get $240 a month in savings to apply to their premium, knocking that right off of the top. A family of 4 with a household income around $53,000 can get over $1,000 in monthly savings. And a 60-year-old with income about $35,000 a year can get more than $1,400 a month in monthly savings, and knocking their monthly costs down to sometimes what we used to call a price of a movie ticket. Not that people are really going out to the movies anymore, but it's just much more affordable. And as Shannon indicated, if you had to convince anybody a couple of years ago about the need for health insurance, I think right now all of us understand the need to be able to take care of your health and your family's health and to not have to worry if something unpredictable happens, because we know certainly coming out of the past year that unpredictable is always out there. On family status, if you are a lawful permanent resident or have temporary protected status, you can get coverage through Maryland Health Connection. The only people for whom it would not be available, that is through Maryland Health Connection, would be individuals who are not documented. But if anyone in the household is eligible, the application does not have to include information about other members of the household. So anyone who is eligible should definitely check this out. What's covered? Preventive care, doctor's visits, hospitalization, emergency care, maternity and newborn care, pediatric care, including dental and vision, prescription drugs, laboratory tests, mental health care, substance use disorder treatment, and COVID-19 testing and treatment. And there's been a lot of people in Maryland who have been helped in recent years by this. We know there's been, for various studies that researchers have done, improvements in the number of young women who've gotten early detection about breast cancer, or people who were able to get into substance abuse treatment quicker because now they had coverage and before they didn't. When can people in Maryland enroll? Right now. We've been running a COVID special enrollment actually for the past, since March 2020, since this all broke on all of us. And it is slated currently to run through August. So if you need coverage and you're uninsured, and I'll give you the numbers you can call too, plus the website, marylandhealthconnection.gov. And you can get coverage for 2021. If you qualify for Medicaid, that is year-round, all the time, any year. You can always enroll for that. And also, we offer a special enrollment period under the Affordable Care Act that for a couple of months after a life event, you've lost a job, so you've lost coverage, or marriage or divorce has changed your situation, you're moving to Maryland, you're turning 26, so you can no longer be carried on your parents' health insurance. Those are all events that would open coverage to you in a regular year. Again, this year, you don't even have to wait for any of those events. You can do it right now through mid-August. And then typically we run open enrollment for the following plan year from November 1st to December 15th. So we'll be doing that again in the fall for the 2022 plan year. But the bottom line is anyone who needs coverage can come and get it right now. What's been the impact of COVID-19 on coverage? The highest number of uninsured in Maryland are in Prince George's and Montgomery counties, in Southern Maryland counties, and in downtown Baltimore City. Statewide, the impact has pushed the number of people without coverage in Maryland to about 422,000, and about 19,000 of those are young adult Hispanic people. Before COVID, it was about 60,000 less than that. So COVID has definitely pushed more people into the ranks of the uninsured. But most of those people are eligible for plans through Maryland Health Connection. And most of those people would be eligible for free or low cost coverage and may not know it, or may have checked it out before and still thought it was unaffordable and should really check it out again. You can see from the chart, even prior to the pandemic, there were higher rates of uninsurance among many communities of color, and Hispanics in particular experienced greater lack of health insurance. Before the Affordable Care Act, Hispanics in Maryland were 3 times as likely to not have health insurance as the general public. I'm glad to say that the Affordable Care Act has helped shrink that inequity. But as you can see from the chart, there's still a large inequity with the uninsured population in the Hispanic community still at least 10%. The general rate of lack of insurance is about 6% or so. So it's we still have a lot of improvement to make, and I think we just struggle sometimes to get the word out about Maryland Health Connection. Plenty of people know about it now in surveys that we've done, but there are still many people who don't, or it's complicated. so they may be dissuaded from trying. But we're here to help. We have hundreds and hundreds of experts, trained experts around the state, navigators who can help you enroll, insurance brokers who are signed up to deliver coverage through Maryland Health Connection, a call center that is available for 200 languages. If people can call at 1-855-642-8572, they can get their answers and their enrollment taken care of, or they can go online again to marylandhealthconnection.gov and can get help through our chat, can get a lot of their questions answered online, and can reach out to a consumer assister that way as well. Again, the mobile app or the computer will show you where at least where you could go to people in person. There obviously wasn't too much in-person coverage help the past year, but we found out that navigators were able to set up times for appointments over the phone with people, and that worked very well. They actually sort of reached probably as many people, if not more, last year than they often have. People like the convenience of being able to set up a phone appointment with somebody, and as we've shown today, people are more adept at Zoom and things like that. So there's plenty of people to help people get enrolled. And as I began the presentation, there is a lot more assistance available coming from Washington to help people afford coverage. And I'm going to stop the video for a second and take any questions that anyone has.
Well, so far there's been one question. Our friend Kate wants to know if the flyer about immigrant eligibility for insurance through the Health Connection can be shared via email. Can you send that to me via email and I can share it out with our members?
Yeah, so they can also go on, I can do that. And also if they go on marylandhealthconnection.gov, we have it all explained on the website as well in detail.
All right. Anybody else
Awesome.
have any questions for Andrew? David, do you have any questions for Andrew?
I just have I'm not sure if as a business owner, we can engage our employees in that route and then cover some of the costs.
We can definitely, I think that is a route that some business owners take. There is also a small business component that you can check out. And I know, David, you're in the insurance business through Maryland Health Connection. And in fact, there are tax credits offered to businesses that employ less than 50 people to help defray their own costs. So there are other ways to get coverage, for the small business owner to help his employees get health coverage.
Yeah, I'm going to have to log on and take a look at that. Thank you, Andrew.
Thank you, David.
Fantastic. Does anybody else have any questions for Andrew? I think you covered it all. There was a lot of information in there, so thank you so much.
A lot of info.
For doing that.
It's
There was
so
one other.
surprising. Go ahead.
Let me share my screen again. I think there was one slide after the Q&A that I cut off of an ask for you all, and let me share my screen one more time.
Sure.
So we also have a social press kit to help people sort of get the word out. As I talked about, a lot of people just don't know what's available to them. And if y'all could go to the socialpresskit.com/Maryland Connect, there's graphics and messaging and different things in Spanish and English to help people sort of propel across, their social media to get the word out to people. Because again, I think any help that you can give us in that way would be greatly appreciated.
Well, I always very much appreciate when organizations like yours put together the information, and then it's just very easy to share it out rather than me trying to figure out how to explain it and how to share it. So thank you for doing that. That's very helpful.
Yeah, I appreciate it.
Like I said, I wish it was spiced chocolate. I really do, but it is complicated. And you can see the enrollment ends August 15th, and that number 642-8572. Would get anybody help throughout all week long.
And there are Spanish speakers on, if they call that line, that they can speak to someone who speaks Spanish if they need it.
Absolutely, absolutely. There's been a lot of enrollment as Hispanic in the Hispanic community in recent years, but I think there are a lot of people who still, either unsure, and obviously there were concerns on immigration statuses and things like that. But we can help walk anybody through that who has a question.
Fantastic. Thank you, Andrew. Thank you.
Yeah,
so
thank
much.
you, Andrew.
Thank you for the opportunity. Appreciate it.
Absolutely. David, so much good information today.
That is some good info. And the numbers are staggering. When you look at the graphs and you see that the inequality on what that Hispanic, Latino, Latinx community is, it's unreal. And I don't know if it's a stigma of I don't want to engage because I'm going to have to pay something every month. But then I think that educating them, and with this pandemic, right, you don't expect things to happen, and things happen. So hopefully folks can, go online in Maryland Health Connection. Thank you, Andrew, Shannon, for providing information on the ease and walkthrough of how to get coverage. I just don't get it sometimes, it clearly there's a lot more folks that can get it than cannot. I mean, so it's I can think it's a matter of educating them, getting the information in front of them, and assisting.
Absolutely. And that's why we want to have these presentations, so that our members hear the information and then they can translate it and share it with their clients and their customers and the people that they interact with in the community. It's our little piece of trying to pass the word along. Absolutely.
It's been great. We kind of how to get our youngsters into the medical field, how to get us covered. And then we kept the culture in there,
There always has to be some culture.
And now if I had a sip of, if this coffee was the spice hot chocolate, life would have been grand.
It would have been perfect.
Yes.
All right, so we have a couple of minutes left, and I know that some of our attendees might have announcements that they want to share. So, hey guys, you know how to do it. Use the little raise hand feature if you have a question that you want or announcement you want to make. David, did you have an announcement you wanted to make?
No, I'm just making sure that they understand they have to raise their hand.
Raise hand. Okay. Oh.
But I did. Okay, go ahead.
No, go ahead.
No, I'm going to do it at the end. I'm the last.
All right. So we're going to go first to our friend Fabiola from BGE, also one of our wonderful LPN board members. Fabiola, I'm going to just click to unmute. Hi.
Can you guys hear me?
Yes. Hi.
Awesome. Hi, David. I just wanted to make the announcement that BGE is opening the Energizing Small Business Grant Round 2 application on May 5th. And we're partnering with the Governor's Office of Small Minority and Women Business Affairs to host a bilingual workshop for business owners on April 29th from 4 p.m. to 6 p.m. to walk through the application process and answer questions. BGE is pledging $50 million to assist Maryland small business with COVID-19 relief and recovery. Eligible business located in the BGE service area can apply for a 20,000 BGE Energizing Small Business Grant. This grant program is part of BGE's comprehensive customer relief and energy infrastructure investment plan designed to help the state's economy recovery from the pandemic. And I'm hoping that you can share this with your networks, and I'm going to be dropping in the links on the chat. Thank you.
Awesome. Thanks, Fabiola.
Awesome. Thank you, Fabiola. Thank you, BGE.
Yeah,
thank you.
All right. So the next person I'm coming to is one of our other new members, David. That is Colleen from the loading dock. Colleen, just click to unmute.
Colleen, how are you, Colleen?
Hi, Colleen. It's me, Colleen from the loading dock. Thanks so much for having us. I just wanted to let everybody know that we are actively hiring for a couple of positions at the loading dock, which if you're not familiar with us, we are a nonprofit building materials reuse center. We're in Highlandtown, almost directly behind where Monument City Brewing Company is on Haven Street. If anybody is familiar with that area. So we are looking for a couple different positions. One is a reuse retail associate, somebody who's going to be interacting a lot with our clients, many of whom are Latino and Spanish speaking. So we're definitely looking for some help there. The other position is a reuse warehouse associate position, somebody who is also going to be hands-on the product and interacting with our customers, but is going to be a little bit more based on working with the material. So I'll drop the link in the chat box. Cindy has been great and put our links on the LPN website, but please, please, please feel free to send it throughout your networks. We're definitely excited to bring a few more people onto our staff, and we have a great team ready to bring on some new people. So thanks so much, everybody. Hope you have a great day today.
Thank you.
Thank you.
And you know what? They are fabulous. If you are going to go there and visit them, you better have time to look around because there's a lot of stuff there. So they are like, you know, you never knew that it was back there.
Thanks.
I mean, I'm a client. I have a little loading dock card.
That's
they
great. Yeah, we're
it's awesome.
Yeah, and we're, I guess, just another quick update. We are open Mondays through Fridays from 9 a.m. to 3 p.m. So it's still a little bit of limited hours due to the pandemic, but we'll make updates, you know, on Facebook, Instagram, all that if that changes. And also, if anybody hasn't stopped by before, we have one of the largest graffiti and street art collections in Maryland on our property.
That's what I was going to say.
So it's definitely. Yeah. So it's like almost going to like an outdoor exhibit while you're there. So
that's what I was going to say. My son said, "Hey, Dad, how do you get to draw on those walls?" I'm like,
you
"Easy
can
there,
contact
son."
me.
Well, very good.
Yeah.
He would love to do that. He does it on paper, keeps it really, really legal. Doesn't do graffiti, but he would ask me the last time we went, "Hey, how do you get your stuff up there?"
That's great. Well, I'll drop all my contact information in the chat as well as the link to the LPN website listings. And great. Look forward to hearing from everybody. Thanks again.
Awesome.
Cool.
Thank you. All right. Next person that I'm going to come to is David. It's our friend Kate from Southeast CDC. Hi, Kate.
Kate, how are you, Kate?
Hello. Can you guys hear me?
Yep.
I have two announcements. I think I make this announcement every meeting, but I just want to remind people that the Southeast CDC has two programs now that are helping people in Baltimore who are behind on their rent or utilities. We have the eviction prevention program, and that's specifically to help immigrants who are behind on their rent apply for assistance to get their back rent canceled. My coworker Rocio, who I know is on this call, also sent me an email on Friday saying that we've had 22 families approved so far, with most of the families getting an average of 4.6 thousand in rental assistance.
That's awesome.
We have a lot more applications submitted. And then we have the Family Stability Program, which is specifically for families at our community schools. I'll put all the information in the chat. Let me actually do that because I can't talk and do things at the same time. And then my second announcement is, in the chat, I'm sorry, so it has the link where you can refer people and also our phone number, and then just a brief description of the eviction prevention program and family stability program. The other announcement I have is that we have a couple open positions at Southeast CDC. We have a community school coordinator position, which we're looking for someone who speaks Spanish to work at Tench Tillman, which is a little bit north of Patterson Park near Johns Hopkins. And then we also have some jobs for the summer for the work that we do with the Youth Works program. So it's a good job for someone who's off in the summer, like a teacher or college students looking for some money this summer and likes working with children. So check that out. Thank you.
You're welcome. Thanks, Kate.
Thanks, you, Kate.
The next person I'm going to come to is Nick. Hi, Nick.
Hey everyone, this is just a quick update. Highlandtown Community Association. I was talking with the president, Nick Kirkley, the other day, and he actually let me know they're looking for someone to assist with interpretation for the monthly meetings. So English to Spanish interpretation, as I'm sure everyone knows, right? That is an area that has our biggest immigrant population. And immigrants are some of the least civically engaged, for many disparity reasons. So we're trying to get that up. So if anyone is interested or maybe working with like a student or a client of yours that may be interested, it's a paid monthly interpretation. Obviously, you'll probably see me doing it for the first one, but someone who may have a little bit more like free time ability, I'll post that in the chat, but feel free to let me know.
Okay, awesome.
Nick. Next person I'm going to come to is Fema Reyes. Hey, Fema.
Hey, Fema.
Hello, everybody. This is Fiamma. I'm super glad to be here.
Murdering you today. I'm sorry.
It's okay, no worries. So I just wanted to tell you guys a little bit about a new agency that I am working at, and hopefully I can connect with Cindy and see if I can do a presentation at any time that there's an opening. But I am currently with a nonprofit that's called Turnaround Tuesday. Not sure if anybody has heard of it, but it's a pretty small nonprofit here, and we are a jobs movement. We work with any individual who is unemployed or underemployed to get them ready for the workforce. A lot of the work that we do is with returning citizens who are just coming home from incarceration or have had a long gap in their work history, and we work to prepare them for the workforce. What makes us different is that we really try to prepare our participants with what we call 4 days of essential skills training, which is really working with them on things that come up in life, right? Tardiness or just conflict resolution, things that might be issues on the job for individuals who have been unemployed for a long time. And then we also have really great relationships and partnerships with a lot of different agencies where we place those individuals once they are ready for employment. One of our greatest relationships is with Johns Hopkins, and another one with the University of Maryland. So one of the things that we are actually recruiting for right now are peer support specialists to place in Johns Hopkins and University of Maryland. So we're currently recruiting for individuals who are able to work full-time, over 18, have their high school diploma or GED, reside in Baltimore City, and have lived experience of active recovery from substance use have been in recovery for at least 3 years, right? That's part of the requirement for a peer support specialist job. So we're currently recruiting for those positions because Johns Hopkins and University of Maryland has a lot that are coming up and opening, and they rely on our connection at Turnaround Tuesday to help fill those jobs. So if anybody is interested in that, I will drop my information in the chat so that you guys can connect with us and we get you started on our process. Again, we'll go through those 4 days of essential skills and then technical skills training specifically for success in the peer recovery job position. So if anybody has any questions, I'll put my information there and you guys can feel free to reach out.
All right. Awesome. Fayama.
Yes.
Okay,
Yeah, thank you.
Beautiful. Thank you. All right. Last one I'm going to come to is our friend Judy from USCIS. Judy, I have like a minute.
I'm going to put 2 links in the chat, 2 updates that are important I wanted to share with everybody. DHS has put through the Federal Register, they want public comment and written comments to be received about how USCIS can improve and eliminate barriers to benefits and services, including for adjustment of status, naturalization, refugee, asylum, and parole. So I'm going to put that in the chat. The other one is the F1 students, when they are going to do pre-OPT or post-OPT, those applications can be done online now. Those are that's a new online process that they opened up. So I'll put those in the chat. And that is it. Thank you.
Awesome.
awesome. Thank you, Judy.
Thanks, Judy.
Thank you, guys.
All right.
Hey, quickly before we move on, I just put something on chat. It's the uscensus.gov. It's the announcement for how they did on the 2020 census. So if everybody wanted registered, the link is on chat. It'll be interesting to see how we favored this year with, this 2020 for the Latino community, primarily here in Maryland or Baltimore. I'm curious to see. So I just dropped it.
I'm curious about that as well. So everyone check out that link in the chat from David. We are over time. So David, do you have any last words of wisdom to share with our friends?
I just want everyone to have a blessed week. Enjoy the rest of the month. It looks like we're going to hit winter and go right into summer.
And everyone watch out for the cicadas. There will probably be cicadas before we meet again. So
we want stories. We want pictures.
Yeah, we'll share our cicada horror stories at the next meeting. All right. I hope everyone has a wonderful, wonderful day. Thank you again to our presenters from Johns Hopkins Medicine, from the Walter Art Museum, Maryland Physicians Care, and the Maryland Health Connection. Thank you guys so much for sharing that information with the community. We really, really appreciate you taking time. And thanks for joining us today. We enjoy having this opportunity to connect with all of you.
Yes, thank you for logging on. Thank you for the board members that were on there.
Everyone have a great day.
Awesome. 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 Now we do lunch. I'm going to get some Dorito Locos.